Yep. All right, so we're going to continue with chapter 7, bone, and this is the second part of it. And in part 1, we talked about the skeletal system, their functions, and we said that skeletal system is not just for structure, it has also got other purposes. For example, it's a calcium reservoir. It maintains the pH of the blood. So there's a lot of functions for it, which we discussed. And we said bone is a connective tissue, right? Connective tissue means it's got matrix and it's got cells suspended in the matrix. And what are the types of cells? Stem cells, osteogenic, which is osteogenic cells. Then you have the osteoblast, osteoclast, and osteocytes. So you need to know all these. And then we talked about the structure of a typical bone. There's an epiphysis and there's a diaphysis. And then we were talking about the bone development. We talked about two types, intramembranous and endochondral. And then we reached the growth zone, which is otherwise called the epiphyseal plate, which is a cartilage between the epiphysis and the diaphysis. So that's what we discussed in the last class. Let's move on. Okay, so epiphyseal plate is very, very important because that is the growth zone. So that's why you become tall. Bone lengthening happens because of growth in the epiphyseal plate. So every bone has got an epiphyseal plate. This is a hand bone, and you can see this is the diaphysis, and this is the epiphysis, and there's a growth zone in between. So when the epiphyseal cartilage gets converted into bone, then that growth zone is ossified. It becomes bone. When it's cartilage, it grows. When it becomes bone, it stops growing. That's when you stop growing. So you reach a height and that's it. That's because your epiphyseal plates have become ossified. But that doesn't mean that bone is going to not grow. Bone is going to grow in width after that. So it's going to get thicker and wider. And how does that happen? That's because there's a lot of bone producing cells under that membrane which is surrounding the bone. What is that membrane surrounding the bone? Periosteum. Peri means around. Osteum means bone. Periosteum. So these bone cells, osteoblasts, residing under the periosteum, starts producing bone. So that's why bone becomes thicker. You'll be surprised to know that the bone, this is called bone remodeling, okay? So bone is constantly broken down, bone is formed. So this is what's called remodeling of bone. So there is a breakdown and there's a buildup. Why do you need this? Because there will be microfractures, and also sometimes body needs calcium. So there's a lot of reasons for it. And this remodeling happens constantly, and it happens all through life. And 10% of our bone is remodeled every year, which means in 10 years, you have a new skeleton, right? If it's 10% per year, 10 years, you have a new skeleton. And I told you the reason for this remodeling is one, repair of microfractures. Microfractures are fractures that happen on a day-to-day basis. You don't know about it. It's happening. Again, we need calcium. Calcium is a ion in the body, which is very, very important. And I'll talk about calcium in great detail because that is very, very important. And another thing is that there is a law called Wolff's law, which means bone is adapting to loads all the time. For example, if you increase the loading of bone, then the bone will become thicker because it becomes stronger. That's why we recommend after a certain age to keep your bone density, go and take some weights. Okay, you can do cardio, which is good, but taking weights is also important. Same thing, if you're bedridden for some reason, then you're not using your bones and the bone will start melting away, because when bone is not under load, then it starts melting away. This is the principle of Wolff's law. So bone becomes weaker if it is inactive, and bone becomes stronger if it is under load. Okay? Okay, so this is a condition here called achondroplastic dwarfism. So what happens in this person? Here you can see this person has got short arms, short legs, but the torso looks kind of normal, right? This is a condition where that epiphyseal growth zone has stopped functioning. So there's no growth in the long bones. That's why this person has got a short stature. And this is a genetic condition. It's called achondroplastic dwarfism. There's another condition called pituitary dwarfism, which is because your pituitary gland does not produce pituitary hormones. Particularly the hormone which is necessary for your growth is growth hormone, okay, which is produced by the pituitary gland. And we were talking in the lab yesterday, where is the pituitary gland located? It's located in the sphenoid bone in a particular part called the sella turcica. So that is that was discussed in the lab yesterday. So in this gland, the pituitary gland does not produce pituitary hormones, which is the main hormone is growth hormone. So what happens is the overall growth is reduced. So these people have very normal body proportions, but there's a lack of growth. You see the difference between the two? Clear? Okay. Let's talk a little bit about bone mineral deposition. So when you say bone mineralization or bone mineral deposition, that means calcium and phosphate is taken from the blood and it's deposited into the bone. Okay, that's what's called mineralization. And who does this? Osteoblasts. So osteoblasts first produce collagen fibers because you need a matrix, right? So it first produces the matrix, which is the collagen fibers, and then the calcium salts, it is deposited on this collagen fibers, which is the scaffold. And then when calcium salts, which is usually in a form called hydroxyapatite. Hydroxyapatite is the form of calcium which makes the bone harder. It hardens the bone. Ectopic calcification. Ectopic calcification simply means there is calcification happening where it's not supposed to calcify. Example, in the brain, in the lungs, in the eye, in the artery. In the artery, you can have deposition of calcium. What is that called? arteriosclerosis or atherosclerosis. That's what's happening in the arteries when you eat all this junk food, a lot of cholesterol, a lot of fat gets deposited in the arteries. And then that will attract a lot of calcium deposits and your arteries will harden. So it is not able to contract. The arteries will expand and it will, when the blood is pumped into the artery has to expand to receive the blood, right? And when after the initial pressure, it has to contract. So this is how the arteries should be working. But when you have calcification, then that mechanism is not working.
Ectopic calcification, that's always negative.
It is a bad thing. Also, in your teeth, you have tartar. You have calcium deposits. That's when the dentist tells you, oh, you have a lot of tartar on your teeth. So that's another ectopic calcification. So ectopic calcification is not good, but sometimes it happens. Okay, so we talked about bone mineralization. Let's talk a little bit about bone resorption. Bone resorption is the opposite of bone deposition, which means calcium is taken from the bone and released it into the blood. And who does this? Osteoclast. So the osteoblast is what does the mineralization. Osteoclast is what does the demolition. So they are the demolition crew. So the demolition is done by the osteoclast. And if you look at an osteoclast, you can see it has got a ruffled border here. And this is where the bone is dissolved at this ruffled border.
Why does it happen?
It happens because they secrete hydrochloric acid, and it also secretes an enzyme called acid phosphatase.
Why would you need to have your bone broken down to your blood?
The two reasons. One is the Wolff's law that we discussed, because sometimes you're not using your bone enough, so the osteoclast will move in, and starts removing bone from there. Or you have a calcium deficiency in your body, and your osteoclasts are immediately alerted. Hey, there's a calcium deficiency here. Go there, take some calcium out of the bone, give it to the body. So those are, and there are other reasons also. But we'll come when we move on. I'm going to talk about more reasons. Also, one more thing where this bone deposition and bone resorption. So one is deposition, the other one is resorption, removing. So if anybody has gone to an orthodontist, what does an orthodontist do? The dentist. They put braces. Why? Move your teeth, correct. And where is your teeth located? In bone. Okay, so they are going to move the teeth. So you have a tooth here, you have bone, the tooth is inside the bone. How are they going to move it if there's bone? They're going to put some pressure, right? And what happens when they put pressure?
Move slowly.
Osteoclast will be activated. Bone will be resorbed. Space is created. Tooth moves into that space. And what happens on the other side? There is deposition of bone on the other side. So on one side, bone is removed. On the other side, it's deposit. So that's how the tooth moves. Okay, yeah.
Our teeth bones.
Our teeth, no, teeth is not bone. But teeth is in bone. Teeth is not bone. Teeth is also a calcified structure, but it is not bone. Okay, so coming back to the question, why does the body need calcium? Body needs calcium, number one for bones, but other tissues also need calcium. For example, nerves, muscles, they need calcium for nerve conduction, for muscle contraction. It needs calcium. And also blood clotting needs calcium. So calcium level in blood is very, very important. When you have a low calcium in blood, we call that hypocalcemia, low calcium. And when you have a high calcium level, you call that hypercalcemia. So you have a hypocalcemia and a hypercalcemia. You don't want both. What you want is normal calcemia. And what's the normal? It's 9 milligram to 11 milligram, approximately. It's written somewhere. So say, for example, if you have hypocalcemia, hypo means low, a deficiency of calcium. What happens in the body? The nerves and the muscle will become hyperexcitable. So when the muscles are in a hyperexcitable state, they go into spasm, they contract, they are very excitable. They go into spasm. That's why you get a condition called tetany. Tetany is contraction of the muscle. And this can be caused by vitamin D deficiency. Vitamin D is one of the factors which helps the absorption of calcium. Also, there's a gland in the thyroid called the parathyroid gland, which is very, very important for calcium, for controlling the calcium level in the blood. The opposite of hypocalcemia is hypercalcemia. Hypercalcemia is when there is excess of calcium in the blood. It does the opposite. It makes the muscles and the nerve less excitable or sluggish. So your reflexes are so sluggish. So what is a reflex? So if somebody puts a hand on towards your face, you move, right? It's a reflex. So if your reflexes are sluggish, you don't move. You kind of react slowly. Yeah. So it's a sluggish reflex if you have hypercalcemia. So it's very important to maintain the calcium balance in the blood. Yeah, here it's written. It's 9.2 to 10.4 milligram per deciliter. That's the normal calcium level. So if you go to a doctor and you say, I'm feeling very sluggish and all, probably you'll say, yeah, we may have to check your blood calcium level. Okay, so let's have a look at how is the calcium level in the blood normally maintained. Number one, there is a balance between the dietary intake and the loss. So there is loss in the urine, there is loss in the feces, and also there are some hormones. There are 3 important hormones: calcitriol, parathyroid. These 2 hormones increase the calcium level in blood. And there's another hormone called calcitonin, which lowers the blood calcium level. Calcitriol is actually vitamin D3, and it raises, when you have vitamin D3, if you have low calcium level, they tell you to go into the sun and walk in the sun. Okay, so what is happening there is that your body is going to produce a lot of calcitriol. And how does it increase blood calcium level? It absorbs more calcium from the gut. It takes away calcium from the bone, releases it into the blood. And the third mechanism is it increases the kidney reabsorption of calcium. So the calcitriol, which is vitamin D, it's a combined effort. It starts in the skin. In the skin, when the sunlight hits the skin, it converts 7-DHC to vitamin D3. And then in the liver, that a hydroxyl group is added, so it's converted to calcidiol. And in the kidney, another hydroxyl group is added and becomes calcitriol. So you don't have to go into all these mechanisms, but important thing is that you should know sunlight is important. Skin is where it starts. Liver and kidney is also part of the deal. Okay? And when you have a deficiency of vitamin D, you have rickets or osteomalacia. What's the difference? Rickets is a condition where there is deficiency of vitamin D in children. Osteomalacia is a condition where there's a deficiency of vitamin D in adults. So one is in children, the other one is in adults. So this is a classic vitamin D deficiency. So you see bowed legs and some skeletal deformities and also some muscle weakness. The other two hormones, calcitonin. Calcitonin is secreted in the thyroid gland. And what does it do? It lowers the calcium level. How does it lower it? The bone breaking cells, which are what is the bone breaking cell? Osteoclast. Osteoclast. What is the bone making cell? Blast. One is clast, other one is blast. Okay. So just remember blast, it's increasing. Okay, so osteoclasts, what they do, they take the calcium from the bone, release it into the blood. Osteoblast is the opposite. Takes calcium from the blood and deposits it into the bone. So here, this calcitonin inhibits the osteoclast and stimulates the osteoblasts. The third hormone. 3 hormones are very important. Parathyroid hormone. So parathyroid hormone is secreted by the parathyroid glands, again in the thyroid. What does it do? It raises the calcium level. And there are 4 mechanisms. Well, it stimulates the osteoclast. So more calcium is taken from the bone into the blood. It inhibits the osteoblast. It tells the osteoblast, don't deposit bone, stop. Okay, so it inhibits it. It reduces the calcium loss by the kidney, and it's also promoting calcitriol production. So these are the mechanisms. There are some other factors which affect the bone growth. You might have noticed the bone growth is in spurts. We call it growth spurts, right? You find children, suddenly they're growing in height. Okay, they are called the growth spurts. So why does the growth spurt happens? It's because the growth hormone stimulates the epiphyseal plate. Epiphyseal plate is where the growth happens. They are the growth zones. The sex hormones have a big role, especially estrogen in girls. So estrogen in girls, what does it do? It causes bone maturation. So that's why girls grow faster than boys and reach full height much earlier. Boys have testosterone. So the testosterone leads to a longer growth period. So boys keep growing, but girls at that stage, they have already matured. Boys keep growing and they reach their final height much later. So males tend to grow longer and tend to be taller. Another thing which boys do, some of them, they take steroids, anabolic steroids, because they built up your muscles, right? So is that good? No.
Only as an adult.
Only as an adult. In the growing stage, if you take it, the epiphyseal plates are going to close prematurely. If it closes prematurely, you're going to end up with a short adult stature. So not good. during the growing stages. Let's talk a little bit about fracture. Normally, when you get a fall, they call it a stress fracture, which means it's an abnormal amount of force which cracked the bone. You fell down or something, and you hit somewhere, and with that force, it's normal for a bone to break. But there is another fracture called pathological fracture, which means the bone is weakened by a disease. So even if you touch bone without that amount of force, I'm talking about a minimum amount of force, it can fracture. That is called a pathological fracture. So that a pathological fracture happens in a bone which is weakened by a disease. Can you tell me a disease which can cause pathological fracture? It happens in the adult, yeah. Brittle bone disease, yes, that's a disease, yeah. But it happens normally in old age, especially in females, and we'll talk about that. And there's a condition called osteoporosis. Okay, and we'll talk a little bit about osteoporosis because that affects your life. And but before we go into that, let's talk a little bit about fractures. So there are different types of fractures. There is undisplaced fracture. If a bone breaks, but it's in a good position, you don't need much of a treatment. They just put a little splint and let it heal. So that's undisplaced. Or you can have a displaced fracture, where the fracture is not aligned. It is kind of unaligned. In that case, you'll have to bring it back into alignment. What do you call that? Reduction. You reduce a fracture. So reduction of the fracture is when you align a fracture. And a compound fracture, when you say a compound fracture, that means the fracture happened and the bone is coming out through the skin. When the bone is exposed, we call it a compound fracture. Comminuted fracture means the bone is broken into multiple pieces, 3 or more pieces. That's a comminuted fracture. Green stick fracture happens in children, like a twig, like a green twig. So it's an incomplete fracture, happens in children, and it's called a green stick fracture. Okay. Who do you think will heal quickly, adult or children? Children, always children, because normally they have a green stick fracture. Fracture healing, 4 stages in the healing of fracture. First, when you have a fracture, you have blood bleeding into the area, and bleeding into the area is called hematoma. So a blood clot is formed, and later that blood clot is invaded by collagen. So the osteoblast will produce a lot of collagen there and convert that clot into what is known as a soft callus. So soft callus is where blood clot is, some collagen is added into the blood clot. And then later, the osteoblast will start the mineralization. It adds calcium and converts the soft callus into a hard callus. And later, so you get a hard callus there. So initially, when a bone heals, it will be slightly overdone. And later, there's a remodeling process. That's when the osteoclast and the osteoblast comes, it remodels the bone, bring it back into the normal shape. Okay? So that's what happens in the healing of a fracture. So I told you, there is a reduction, you have to align it, and there's a fixation. And reduction can be a close reduction, which means you're not operating. Basically, you can, a bone is broken, you hold it together, you can align it, you take an X-ray, you're happy about it, you put a cast, and that's the end of story. But sometimes that's not possible. Even if you try to align it, it is not getting aligned. You take an X-ray, it's still not aligned, then you have to open it. You have to do an operation. You have to open it, put the bones back into position, and put some plates or something to hold it there. And that is called an open reduction. And then reduction is followed by immobilization, because it can slip back into the old position, right? So it has to be immobilized. So when you immobilize it, normally we put a cast. But sometimes if you're doing an open reduction, you can use small plates and screws and put it into good alignment, put this plate there, put 4 screws there. It's carpentry basically. And you put the screws inside, hold it in. And that's what you see here. You can see this is broken here, and a plate was placed, screws are placed, and it's back in position. Osteoporosis, this is what we were talking about. Osteoporosis is a common bone disease. What happens? There's a loss of bone matrix and also loss of minerals. Usually affects Caucasian women, Asian women, and it happens after a certain age. And usually after menopause. What happens after menopause? Lack of estrogen. Yeah, that it's more common when you look at statistics. It's more common in. Well, it happens for everybody, but it's more in. So these are we call them the high risk groups. Yeah. So if you have somebody who's Caucasian or Asian, they are more at risk. So at menopause, the ovaries stop secreting estrogen, and estrogen is what inhibits the demolition cells. What are they? Clast. Yeah. So the osteoclast becomes active. And by the age of 70, about 30% of the bone is lost in females. But that's not the only risk factor. There are other risk factors. For example, alcoholism, smoking, diabetes, nutritional status, diet poor in calcium, diet poor in protein, diet poor in vitamin C, vitamin D. All these are important, okay? So what's the treatment? The best treatment would be a change in the lifestyle. You take adequate with calcium, you take adequate vitamin D. Sometimes some people recommend hormone replacement therapy, HRT, but that has got risk. Okay, so you have to discuss that with the doctor and see what are the risks, benefit, and then decide. Some medications are used. There's a medication called bisphosphonates. What does bisphosphonate do? It inhibits the osteoclast. There's another hormone, PTH. We talked about PTH. PTH is parathormone hormone. And this hormone will stimulate bone formation. But you can't give these hormones without control. It has got other effects, side effects. So it's all a balance. So these are all the treatment options. But the best approach is prevention. So how can you prevent osteoporosis? By a change in your lifestyle. If you're a smoker, stop it. If you're diabetic, control it. Good nutritional status is important. Diets rich in calcium, protein, vitamin C, vitamin D. These are all what has to change your lifestyle. Get into the habit of exercise. Go to the gym. Utilize these resources and stay healthy. And this is, what do you call this condition where there is actually excessive curvature of the upper back? It's called Yeah, widow's hump or kyphosis. Kyphosis is the scientific name. It's an excessive curve on the back. And that is because of vertebral bone loss. You can see the vertebrae starts losing a lot of bone. That's why it happens. Okay, so any questions? Stop share. Stop recording. Yes.